Hello, everyone, and welcome back to our weekly webinar series that occurs here on our Facebook page every Friday at noon. My name is Brianna. I'm a Sustainable Transportation Intern, and I'm so excited to introduce our speakers today. So today we have with us Dan Quinlan, and Dan is an independent consultant who works with national and international NGOs and businesses organizations on clean energy and climate change projects. We also have with us Jared Ulmer, who has managed the Climate and Health Program at the Vermont Department of Health since 2015. And then we also have with us Jonathan Buonaker, who is a research scientist at the Center of Climate and Health and Global Environment at the Harvard Chan School of Public Health. So I'm going to bring them all up and give them some time to give their own introductions, and then we can move into the presentation. So first, I'm going to bring up Dan. Hi, Dan.
I'm live, okay.
Yeah,
Good afternoon.
thank you so much for being here.
You bet. Good afternoon, everyone. We're looking forward to this presentation, and we've got a great lineup of speakers.
Would you mind just talking a little bit about yourself and just how you became interested in this topic?
Sure. So I've been doing work related to climate change and health for 5-6 years now, and climate change more broadly for about a decade. And in the course of that work, of course, in Vermont, but also the other Northeast states, well, most states of the United States, transportation is a driving force, the number one driving force of climate or carbon pollution. So TCI is a huge, as you know, we'll hear more about it, region-wide initiative that will really have a big impact. So we're really pleased to be able to talk about that and about, in particular, the health impacts.
Awesome. Thank you so much. So now I'm going to bring up Jonathan. Hi, Jonathan.
Hey.
Thank you so much for being here.
Thanks for having me.
Of course. Would you mind just explaining a little bit about yourself and how you became involved in this project?
Yeah, so my name is Jonathan Buonaker. I'm a research scientist at the Center for and I mean, I've been doing work related to health benefits of climate policies for probably most of my research career. So I was really happy to be able to take part in the TREC project, which is evaluating different options for what TCI could look like.
Awesome. Thank you so much. And lastly, we're going to bring up Jared. Hi, Jared. How are you?
Hi, great. Good afternoon. Thanks for having me.
Of course.
So as Dan said, I've managed the Climate and Health Program at the Vermont Department of Health since 2015. We're funded by a grant from the Centers for Disease Control to identify and respond to climate impacts on health in Vermont. So a lot of my work is about adaptation and reducing health impacts of climate change. Today, we're talking about sort of more of the fun side of my job, which is talking about how climate action can actually benefit health. And my background is actually as a transportation and land use planner, and did previous work on modeling health connections to community planning and transportation planning. So the project I'm going to talk about today is something really near and dear to the work I've been doing my whole career.
Awesome. Thank you. And we're all very much looking forward to this presentation. So what I think we're going to do is start off with Jonathan, and Jonathan's going to show us some slides, and then I'll keep you updated with how the rest of the presentation is going to go. So.
There you go. Slides are up. Okay. Yeah, so thanks again. Yeah, so as I mentioned again, I'm Jonathan Buonaker. I'm part of the TREC team. Could you just go to the next slide, please? Could you go to the slide after that, please? Yeah, there we go. Okay, so TREC, it's a multi-university team that's researching transportation, equity, climate, and health. We're doing an independent analysis of, right now, 5 different policy scenarios that are related to the Transportation Climate Initiative. And right now, we've been sharing preliminary results, the purpose of fostering dialogue and informing different policy choices, including the MOU that's supposed to come out later this year. To perform this analysis, we relied on peer-reviewed computer models that have been previously published and that are commonly used by EPA in different states in regulatory analysis. The results here have been reviewed by our team of 10 different experts. However, it is not yet published in scientific journals. So we've labeled it as preliminary. And again, the results here are illustrative. They are not predictive. The actual benefits that TCI is going to have for people will really depend on state actions. These include things like the cap level, the degree of investment, where and what things are invested in, and different kinds of complementary policies. Because of that, these are illustrative. Next slide. So just to go through what TCI actually is. It's a regional collaboration that aims to reduce carbon dioxide emissions from on-road vehicles. Its mechanism is proposed to be a cap and investment structure in states ranging from Maine to Virginia and Washington, D.C. How it would work would be to apply a cap to on-road diesel and motor gasoline. The regulation would be applied to liquid fuel wholesale suppliers. And in order to sell, they would need to hold allowances for the CO2 content of their fuels. The allowances would be auctioned off, and the amount of allowances that would be auctioned would decline over time. And the proceeds from these auctions would be distributed to the states for investment. This is intended to start in 2022. And there's different scenarios that would reduce CO2 from between 20 to 25% from 2022 levels to 2032. And this is equivalent to about a 1 to 6% reduction comparing the policy scenarios to reference scenarios in 2032. And we're expecting the final version of the MOU to be out by the end of 2020. So just to give the insights from our preliminary results first, we expect the estimated health benefits, they're substantial, they're larger than estimated proceeds, and for the subset of the benefits that we examined. Health benefits included up to about 1,000 deaths avoided, depending on scenario, along with about 5,000 childhood asthma cases for the top performing policy scenario. The scenario that had the largest health benefits is the one that had the most ambitious cap, the 25% cap, and it also had the largest share of investments going to public transit and active mobility. Under all the policy scenarios, the health benefits occur in all counties across the region and tend to be concentrated in the more populated areas. Policy scenarios, they do a modest job of reducing inequities in air pollution exposure by race and ethnicity. However, to really correct these pre-existing inequities, there would need to be more reduction in emissions and more reduction in air pollution exposures. And I guess our last major finding is there's a nearly 4-fold difference that exists in the health benefits across the different policy scenarios, which really goes to underscore both the wide range of possible outcomes and also how much the benefits that you would realize from the policy do depend on state actions. Next slide. So the 5 policies here, it's easiest to kind of look across the top. So you'll see that we have the scenario A, scenario B, scenario C with 3 different cap levels. 3 different cap levels for our scenario B. Next slide. And you can see that there's a few different places where the investments are being directed. There's electric vehicle infrastructure for kind of private vehicles, low to zero emission buses and trucks, transportation expansion upkeep, pedestrian infrastructure, system efficiency, and this indirect and other. Next slide. So the most notable of the differences between the scenarios really is the degree of electric vehicle rollout, where under scenario A, it's about 5%, and then under scenario C, it's about 54%, and scenario B is in between the two. Next slide. And then you can see kind of inverse to the electric vehicle rollout, you see the degree of expansion of transit changes, where under scenario A, about 35% of the proceeds go to transit expansion and down to very little under scenario C. Next slide. So we looked at two different types of health benefits here. The first one was active mobility, and then next slide will be air pollution reductions that result from the from reduced emissions from on-road vehicles. Next slide. So here, this shows the preliminary results for 5 of our illustrative scenarios here. And you can again see this really wide range in the benefits. The scenario A with the 25% cap, there it shows there's about 1,100 estimated deaths avoided. This is due to all causes, both health benefits of increased physical activity and health benefits of decreased air pollution exposure, and then down to about 280 for the 20% cap under scenario B. You can see the values below that scale roughly with the lives saved, and then below that even further, you can see the total amount of proceeds that are gained. Next slide. Yeah, so I guess these next few slides are just talking through what I said before. So again, there's this huge range in difference in both proceeds and the value of the health benefits. And the next slide is you can again see the real range in the amount of health benefits you'd get under the different scenarios. Next slide, one more. There's our 1,100. So a few caveats here. So again, these scenarios are illustrative, not predictive. And we did it for the purpose of informing program design. Again, the actual benefits are going to depend on what the states do. They assume that about 83 to 93% of the proceeds are reinvested in transportation. The analysis focuses on-road emissions, and they don't directly incorporate potential changes in emissions from the electrical grid, but we have done some initial screening calculations on that. The scale of our analysis is smaller than a county, but larger than a neighborhood. It's a pretty high detail one for regional, but it's really not intended for analyzing changes at a neighborhood scale. We didn't analyze other climate-related health benefits or other health benefits that you would have from improving transportation systems. These are things like road safety, noise pollution, congestion, access to jobs, healthcare, and things like that. Next slide. So this is just going in depth for the estimated benefits for biking and walking. You can again see the range across the scenarios here. Next slide. Going from 770 lives saved to 200, with the value of those deaths below, and then below that again is the amount of proceeds that are invested in the biking and walking infrastructure. Next slide. So let's go next 3. We have a lot of different animations here that aren't working well. So this map here shows where those benefits are occurring, and they're normalized to population to kind of wash out the effects of just massive people. So per 100,000 people, you can see that there's widespread benefits across the region, but they do tend to be focused in areas with fairly high population density. Next slide. Some additional insights from this is that, interestingly, the benefits to physical activity, they're larger than the air quality health benefits, which really underscores the benefit of having more opportunities for physical activity. Our top scenario had the largest share of investments dedicated to public transit and the biking and pedestrian infrastructure. And shifting from vehicles to other modes of travel has double benefits of both increased activity and reducing tailpipe emissions. We weren't able to look at the equity of the distribution of these benefits, but it definitely is an important consideration of policy and will be a topic of future research. Next slide. Next up is the health benefits to improved air quality. Next slide again. This is just showing the amount of health impact that we see for the region in 2016. We estimated that there's about 10,000 premature deaths due to air pollution from on-road vehicles in 2016. And most of these deaths are in the areas of both high traffic and high population. So New Jersey, Pennsylvania, and New York really pop out. Next slide. The approach that we took to air quality modeling was to look at the differences in air pollution for the 5 different scenarios compared to one reference scenario. Again, this modeling, it's larger than a county, but smaller than a neighborhood. You can see the grid there on the right, where these blue grids. The blue grid is the modeling resolution of our air pollution model, and you can see that superimposed on a map in New York. You can see a lot of grid cells fit into a county, but if you want to know what's going on in your neighborhood, we clearly need to have a higher degree of detail. Next slide. So this shows the air pollution benefits in terms of change of PM 2.5, which is one of the pollutants that we're worried about from a health standpoint. And you can see the air pollution benefits are centered in the high population areas. Next slide. So as expected, the change in ozone, it's again fairly concentrated in the high population areas, but because ozone is more of a regional pollutant, you see more regional benefit where you have fairly high reductions going up into Maine, New Hampshire, Vermont, and Western New York, along with the heavily populated cities on the East Coast. And next slide. Again, as expected, we see focused on cities a reduction in NO2 as well, really largely focused on cities just because NO2 has even lower lifetime in the atmosphere, so it doesn't travel as far. So next slide. Preliminary results from this, again, indicate that for the 5 policy scenarios, there's a modest reduction in the inequity of air pollution exposure by race ethnicity. The disparities do persist under all the policy scenarios in 2032. As you increase the stringency at a cap, the equity and health benefits do also increase. And both the equity and the health benefits are highest in the scenario that has the greatest investment in public transit and biking and walking infrastructure. Next slide. This goes into the demographic breakdown of the reductions in air pollution exposure in detail. So you can see the results again for the scenario B, and then the percent decrease next to it that we have circled here. Basically, the larger the number, the more your decrease in air pollution. So you can see there's a fairly high decrease in both non-Hispanic, Black, and Hispanic populations, and that's higher than the decrease that the rest of the population is experiencing. Next slide. And looking at the column to the left of that, you can see that despite these decreases, there are still much higher exposures for Black and Hispanic populations. Next slide. This is showing the region-wide health benefits. Again, you see a similar range where it's 330 lives saved under scenario A with the 25% cap, and then down to 80 with the 20% scenario B. Next slide. So again, you can see that range here, and then next slide. Yes, this is just showing, again, that range, but also kind of showing that this, what we estimate here in this scenario is about an 8% decrease in the estimated deaths from the estimated on-road emissions. So it's a fairly substantial decrease in the total health burden of transportation. Next slide will be a map showing the health benefits. This is, again, normalized to population. So while it does show that there are health benefits from air quality improvements everywhere, these do tend to be largest in the more heavily populated areas. And then last slide, just to recap, second to last slide. Again, the estimated health benefits, they're substantial and they're larger than the estimated proceeds for the subset of benefits we examined. They range from about 1,000 deaths and about 5,000 childhood asthma cases avoided for the top performing scenario for 2032. The policy that had the largest health benefits still is the one that had the most ambitious cap, 25%, and the largest share of investments dedicated to active transit and mobility, active mobility and public transit. Health benefits occur in all counties under all policy scenarios, but they're more concentrated in populated areas. Policy scenarios, they will modestly reduce inequities in air pollution exposure by race and ethnicity. People of color would still face higher overall air pollution exposures, and more emissions reductions would be needed to address these pre-existing inequities. And we did find there's a nearly four-fold difference across the different policy scenarios and health benefits. Again, underscoring the wide range of possible outcomes and that the actual benefits will depend on what states do. A little bit on the next slide about what's next. Again, this is preliminary, so it's all subject to change in the process of submitting these different papers to different peer-reviewed scientific journals. We would like to post an online data viewer, do a more expanded equity analysis, run more additional regional scenarios, look at the grid emissions more closely, and look at local case studies in a few different urban areas that have higher levels of air pollution. And the next and last slide shows the entire team. You can see there's myself, Sarv Arunachalam from UNC with his doctoral student Calvin Arter, Olik Berberian and Ricky Pereira at Columbia. And from BU, we have Matt Raifman, John Levy, Pat Kinney, and Laura Buckley. And we also have Charles Chang, who's working with Sarv at UNC as well. And then Kathy Fallon-Lambert, who's working with me. So with that, thank you.
Thank you so much for that. So now we're going to move on to Jared. Here we go. And Jared's going to be talking about improving health through transportation. 1 second, I'm just pulling up. There we go.
All right, thank you very much. And thanks, Jonathan, for that great overview of the preliminary health benefits of the Transportation and Climate Initiative. I'm going to talk about a project that we completed about a year ago, which is somewhat similar in that we are also curious about what sort of health benefits Vermont could derive from making changes to our transportation system to address climate change. Ours is a bit different. I'll point out some of the differences as we go along. Ours is a little bit more of a dream scenario of say we actually meet our comprehensive energy plan transportation goals, what sort of health benefits might we receive? So we decoupled from reality to some extent in that we didn't identify specific policies and strategies that could be used to meet those goals. It was more of a just purely what if we make changes that help us meet those goals, what might the health benefits be? So that's a really key difference I want to point out up front, but I'll point out a few more as I go. Next slide, please. Yep, thank you. So just wanted to kind of call attention. I mentioned that a lot of my job is about responding to potential health impacts of climate change. This is the more sort of motivational, proactive part of my job where we get to talk about how taking climate action can benefit health. And two key areas that we've really focused in the last couple of years are on transportation and building heating, since those are the two key sources of emissions in our state. And we know that there are climate actions associated with both of those that can provide pretty substantial health benefits. So we'll drill down into the transportation one on the next slide. We have a state comprehensive energy plan that is updated, I believe, every 5 years. I think if you just press forward once or twice, it'll zoom in a little bit. Yeah, one more time. Okay. And I just want to acknowledge gratitude that the comprehensive energy plan calls attention to health benefits associated with energy actions. There are 3 guiding goals that sort of provide an overarching strategy for energy actions in the comprehensive energy plan. economic, environmental, and health. And so the health goals mention some of the potential health benefits from getting people more physically active, improving outdoor air quality, improving indoor conditions in buildings. There's a wide variety of ways that we can improve health through energy actions. And so that's kind of front and center in the Comprehensive Energy Plan. Next slide, please. The Comprehensive Energy Plan has a chapter on transportation, and I am listing here sort of the 9 key objectives from the transportation chapter of the Comprehensive Energy Plan. I put boxes around 5 that we were able to model through the exercise I'll describe. And just in brief, it's basically keeping travel mileage per person constant, reducing the number of people driving alone, increasing the number of people walking and biking and using transit, and increasing electrical vehicles across the state. Next slide, please. Unfortunately, in this yearly assessment that's done of how well we're doing in meeting those objectives, this comes from a Vermont Transportation Energy Report that calls for a lot of these objectives that progress is lagging the target. Basically, we're not doing well. We're not doing enough. We're not doing it fast enough. I've called out 2 examples here. If you just press forward, I think 1 or 2 times. Yep. On the left is the pedestrian and bicycle goal. We're supposed to be doubling the number of people walking and biking to work by 2030. So far, we've actually gone down a little bit. So the steep upward path we need to be on is just getting steeper. On the right is electrical vehicles, the percent of the total vehicles in Vermont that are electric. We are moving in the right direction there, but just not quickly enough to meet our objective. So really need to ramp that up. So unfortunately, for a lot of the Comprehensive Energy Plan transportation goals, we're not doing enough yet. So we wanted to step back and say, well, what if we actually could meet these goals? What's the health opportunity there? What are we going to miss out on in terms of health benefits by not meeting these goals? Next slide, please. So starting with the punchline, what we projected from our modeling exercise was that by 2050, we estimated that we could prevent 2,000 early deaths in Vermont due to increased physical activity, cleaner air, and safer roads. That would save $1.1 billion, both from reducing healthcare expenditures and increasing worker productivity. And that cumulatively over that period of time, that's 30 years from now, there would be 38% fewer emissions from passenger vehicles than if we just sort of had our status quo system into the future. So I do want to point out a couple of key differences here. Jonathan's example was for one specific year in the future, 2032. Ours is looking at cumulative benefits, added together from now all the way through 2050. So a much longer period of time. The costs we're showing are just the direct economic costs. We didn't include what economists refer to as the value of a statistical life. Somehow people have figured out that every preventable death is worth about almost $10 million to the economy. So we did not include those. That would add about another $20 billion if we included that in our estimates. Our estimates were for, like I said, physical activity and cleaner air, which were the same as in the TCI analysis. We also included road safety, knowing that if we had fewer people driving and more people walking and biking, those would sort of have some counterbalancing impacts on collisions and injuries. And we still found a little bit of a net benefit there, mostly because of fewer people driving. Next slide, please. So breaking it down a little bit further, the bars below, the purple that I want to draw your attention to is basically how much of the estimated benefits we attributed to walking and biking versus mostly the air quality benefits were the remainder. The top bar shows that if we basically just met the electric vehicle goal, we could save about 50 lives in Vermont by 2050. But if we also meet the other goals, keeping travel miles flat and increasing walking, biking, carpooling, public transit, we'd save many more lives. We'd save much more in terms of healthcare costs and worker productivity improvements. So that was a really really interesting takeaway for us, that the biggest health opportunity for us is in getting people more physically active. There is some benefit associated with cleaner air, but as Jonathan pointed out in the maps he shared, a lot of the air quality benefits are going to be really concentrated in the Northeast, among the more populous kind of I-95 corridor areas. So not to totally undersell those here. There's clearly some benefits, but in terms of health, the big opportunity is for getting people more physically active. The little bar at the bottom, just to point out, our analysis does show that electrifying vehicles is really key to reducing greenhouse gas emissions. So to meet climate and health goals, we really need to do, an all of the above strategy. Next slide, please. And just to point out a little bit of where we're at and why this is important, at least according to the 2009 travel survey for Vermont, Vermonters on average spend about 488 minutes in traveling in some way every week, but only 48 of those are spent walking and biking. The general recommendation that adults should get about 150 minutes of physical activity per week at a minimum to meet just kind of basic physical activity goals for health. We know that increasing physical activity will have major benefits for health. Right now, 2 out of 5 Vermonters don't get enough physical activity. Physical activity increases risk for a number of chronic diseases that cause 40% of all deaths in Vermont. And currently in Vermont, we spend about $2 billion every year treating largely preventable chronic diseases, and that cost just goes up every year. Next slide, please. And this is a real oversimplification of potential strategies that we could use to meet these objectives, but we just wanted to point out there's a lot of opportunity here. About 40% of vehicle trips in Vermont right now are 2 miles or shorter, and that's a very walkable or bikeable distance for many people. Of course, we have hills and weather to contend with, so we have some very Vermont-specific challenges. But we know that with better and safer infrastructure, electric bicycles, that can really help with the hill issue at least. We actually accounted for in our modeling that about 50% of people would be using electric bicycles in the future, and there are actually pretty substantial physical activity benefits still associated with electric bicycles. We can improve access for a lot of Vermonters through transportation services, and we really need to prioritize our land use patterns and concentrating development and increasing affordable housing in our villages and cities to help us meet those goals. Next slide, please. This is my last slide, just to point out a couple of other just methods, details. We used a model called the Integrated Transportation and Health Impacts Model to create these estimates. It's fairly similar to the HEAT tool that was used in the analysis Jonathan described for the physical activity modeling, but it allowed us to use much more detailed local data where we had it. We did a much simpler air quality modeling exercise, but the peer-reviewed evidence behind relating air quality benefits to health is very similar between what Jonathan described and the model that we used. I also just want to acknowledge that we had a lot of support from the University of New Hampshire Sustainability Institute in supporting this project, and could not have completed this without their support. So I'll end there. a lot of these materials are available on our website. The link is below. A lot of what I presented is from a 2-page handout that you can download.
Thank you so much for that, Jared. So now I'm going to bring Dan up. Hey, Dan, I'm just pulling up your slide really quick.
All right. Hello, all. As that's happening, I'll make a few comments. Also, you'll see over in the public chat, you can put in some questions. We're going to have 10 or 15 minutes for questions. So, so if you've got any, please put them over there. Broadly, one comment, I'm going to step back and kind of make a broad set of comments about what we're talking about here. So first of all, I think people understand the scope and scale of the problem in terms of a couple things. I want to reinforce that. So one is we know that we're not going fast enough. The data is pretty clear on that. The other part is that that people are aware of, but maybe less aware of the numbers. It has to do with the size of the issue that we're dealing with from a business perspective. So a few days ago, I gave a presentation with some other folks about divestment. And what we were talking about was the scope and scale of the fossil fuel industry. So the good news is that if you compare the income of the top 20 fossil fuel companies from 2018 to 2014, in 2014 it was about $4.7 trillion. In 2018 it was about $3.9 trillion. So it's dropping. It's not dropping fast enough. There are other things going on and affecting those numbers, but it is indeed dropping. And we're seeing the coal companies go out of business. We're seeing Wall Street finally starting to talk about the fossil fuel companies as being risky investments, those kind of things. On the other side, we're also seeing the numbers in investment in clean energy across the planet going up. So those are broad trends that are in the right direction. And the problem is that the challenge is we need them really to accelerate. Next slide, please. So I want to do this in the context of the point of view of the three of us on this call is really around the health aspect. And from a messaging point of view and a way that maybe we move faster is to get try to convince more people and get them to understand that climate change is fundamentally a health issue. You can talk about jobs and economics and those other things, but in the end, those are supporters of or founding drivers under our health and well-being. And the Maslow hierarchy of needs, which many of you are probably familiar with, kind of lays out what the basic needs are of human beings in terms of their psychological and physical well-being. So that's really what we're talking about here. Is we need to be having a point of view with respect to the environment and climate change that enables that and supports that. If you could next forward this. So the Maslow hierarchy of needs is based on the individual, and what we're really trying to do is to say climate change needs to be framed from a Maslow hierarchy of need kind of point of view, but it's not on the individual, it's on communities. So we really have to be talking more and more about public health and community health. And you'll see if you, in the coming months, that a lot of the work that's happening around TCI right now, so across the different regions, a lot of the advocacy groups are weighing in on it. And what you will see is a huge emphasis on equity and health of communities, particularly at-risk communities of various sorts. So that's really in the positive direction. We just need to get more people to kind of understand that point of view with TCI and the whole problem in general. Next slide, please. So what we're talking about today, this is a diagram from the CDC. It is in the center, it talks about what the climate and weather effects are that are being affected by climate change and environment pollution. And on the outside are the impacts that relate to human health and well-being. And a really important point I want to make is that the work that we heard about today is modeling, as you heard, air pollution, and also the health benefits of active transportation. But if you look at this diagram, there is a whole lot of things that aren't being modeled. In Vermont, we hear a lot about the explosion of vector-borne or insect-borne diseases, for example. We have issues with cyanobacteria in our lakes and streams, those kind of issues. And then if you think more globally, and we're all aware of what's going on globally, there are bigger issues that play out over time. None of that's being modeled as part of this. And I don't mean that as a criticism. I mean that as to point out that in many of these cases, we don't know how to model them. And in fact, you could argue some of them will never be modelable. So that's a backdrop for this. I would argue that if you could model all of these things, the numbers that we're seeing in these types of analyses, both this TCI analyses and others, are probably off by an order of magnitude, maybe more. The dollar figures that we're talking about here are massive. So that's an important thing to keep in mind when thinking about the dollar and the economic analyses that we're seeing. Next slide, please. In 2019, the World Health Organization identified climate change as the #1 threat to human health in the 21st century. Another effort, a global group of entities, put out a statement in late 2018 that represented 6 million healthcare professionals across the planet, basically saying the same thing. So this health message is big, it's growing, the understanding of it is growing within the medical and health community, but it needs to be articulated through and through in all the work that we do in trying to guide these policies. And it's actually the #1, I believe, message that should be put forward. And part of that is because it's true. And this is really fundamentally starts to be a moral and ethical thing that we're fighting. But then if there's a book I'll show, let's see if you can see this. I don't know if you can read that. But anyway, it says, How Culture Shapes the Climate Change Debate. It's a great little book by a fellow named Andrew Hoffman. And it talks about this, cultural divide that's causing so much problems. And one of the ways we get through that is to talk about the health issue and the health aspect of this as a way of potentially bringing communities together. Next slide. So I'll wrap up in that same vein. A great quote from Nelson Mandela: "We're all in this. We are together in this. Our human compassion binds us one to the other. As human beings who have learned how to turn our common suffering into hope for the future." And then the great little quote from Mary Oliver. If you don't know her, she's a wonderful poet and written many great things about the environment and what's happening. And one of the things she says, keep some room in your heart for the unimaginable. So I imagine many people on this call are concerned about things as I am. I'm seeing in some of the questions, people are talking about the speed with which we're doing things. And the key is keep your head down, keep working, and also that there is not one solution. TCI is not the sole solution here, and no one who is advocating for TCI is saying that. We need a whole host of solutions that involve community involvement and our interest in the health and well-being of our families, our kids, all Vermonters, all people in the US, and in fact, the whole planet. With that, I will, next slide, please. I will wrap up. So please, I've seen some questions going through the chat, so that's good. I'll get to them in a second. I'll also mention these presentations will also be up on the Sustainable Transportation Vermont and the Vermont Climate and Health Alliance site over the next few days. Also on this slide, you see our emails. Feel free to shoot us an email and to continue the conversation. So quickly, I just wanted to ask both Jonathan and Jared, with respect to your work that you're thinking about and the impacts of health as it relates to transportation and TCI, what's next? What work do you think you'll be doing in the next month, year?
You want to start?
I was hoping you were going to start.
Okay. Well, I can start then. I mean, we're an independent group, independent of the TCI process. So we've submitted some grants to some various groups to do a round two, and like I said, it's going to be focusing on electrical grid infrastructure, or sorry, the generation needed to run electric vehicles. Do a more in-depth equity analysis and look at more different kind of state level scenarios.
And for me, I think the reason I was hesitating some is I think it's a bit challenging knowing how best to proceed here, both because of how focused the health department is on COVID response right now, which unfortunately gets in the way of a lot of the other things we'd like to be working on. But this is also, doing this kind of work is exciting from the health department, but it's also not an area where we're like the key funder or implementer. So a lot of what we do is just try to communicate this kind of information to partners. So it's great to be here today. We engage with our state agency partners regularly and share this sort of information with them. So for us, it's just kind of getting the word out to hospitals, to our local health offices and local partners, to regional planning commissions. Communications is really sort of the key for us in moving this work forward.
Thank you. There's a couple questions from one person. Let me see if I can summarize them. So this question starts, is there a concern that by embracing a market-based solution, we're pursuing a path that will attempt to decouple emissions growth from economic growth? And he's got some other comments there about that. So I think at the risk of not interpreting what he's saying well, I'll do my best. But I think his point is that this is our economic system. We have a huge growth issue. If we continue to grow our economy the way we do it, that relies heavily on fossil fuels and carbon pollution. And that the speed with which we need to slow down or to change our economic system to drive the carbon emissions down is not on pace for what we want to, for where we need to be. And so I kind of responded a little bit to that in my comments, which is partly the TCI is not the be-all, the end-all. I'll also say that no matter what, the price of fossil fuels is going to go up. It has to go up because people respond to both carrot and stick. And one of the ways that we have to get people off fossil fuels is to drive the price up. That's going to happen one way or another, and it's inevitable to work the speed that we need to have to work out, in my opinion. So, Jared and then Jonathan, any broad thoughts, comments you want to make about that?
Yeah, I mean, I don't think I can comment much on the market aspects or how much more we need to do. That's kind of out of my area of expertise. I think in terms of health opportunities, you're spot on that TCI shouldn't be the only thing that we do. I think it's clear there are some health benefits associated with it, but to really tap into the biggest improvements in terms of health and equity and accessibility. I mean, there's a lot that neither of us could cover in our models, where we need to make changes in this world, getting people to jobs, making sure people have safe, affordable, and reliable transportation in a state like ours. We have an obesity and chronic disease crisis going on. I'm a little hesitant to say in the middle of the COVID pandemic, but there's such large health issues that are going on in addition to COVID that we haven't addressed very well. So certainly within the health realm, there's so much more we need to be doing.
Any thoughts, Jonathan?
Yeah, there's kind of a lot in the question. It's I mean, definitely true that TCI is not like nobody's saying it's the one and only thing that we can do, should do, or are going to do about climate change. Um, but no, there's a good point. Like I was looking up here, the UN, they do this gap report every year, and basically we need to cut our emissions by 7.6% per year every year if we want to reach the goal of 1.5 degrees. So it's pretty clear that TCI is not going to be sufficient to do that on a global scale. Um, and I always like it's this person also mentioned in the comments some issues about political feasibility as well. And I think there's a little bit of a tension here between like how basically how quickly we need to go to meet these goals, and also what other people are willing to do. Um, and I haven't been sitting at the table, but oftentimes, um, I haven't been sitting at these tables, but there is a tension um, between what people are willing to do and what we need to do to actually meet the goals of climate change. And this clearly sits in between sufficient to meet the goal set out by the UN and nothing.
Thank you. There's another question. Has to do with kind of the connections here between, I'll try to summarize, electric bikes, electric vehicles, so new modes of transportation, and accelerating the adoption of those in society, and the connection to TCI. So the way I understand it is that basically what's happening here is TCI generates a bucket of funds. Those funds are available to each state to use as they wish. And so Vermont could certainly choose to invest that money in ways that accelerate those markets as best we can, given a small state. We're not going to, dramatically alter the EV market, but we could have some damage and beneficial damage in terms of helping to grow the e-bike market, for example. We could also be putting in more infrastructure for charging and accelerating those kind of ideas. And so where I think the linkage is here now is that it's up to all of us in whatever state we live in this case Vermont, to be pressuring state government when these funds are available to be saying, all right, here's how we think this money ought to be spent. So that's the opportunity to make some linkage between growing those particular markets and the money that's going to come in via TCI. Either of you guys any other thoughts about that, comments?
Covered it pretty well.
That was well summarized. I am state government, so I don't want to get into pressuring myself to invest in certain places, but we certainly engage, with our state partners on the strategies, whether it's related to TCR or not, in making sure that health is a consideration of those conversations, and it's obviously not the only and not necessarily the most important consideration. But I just want to acknowledge that health is part of those conversations. We really appreciate that health is part of those conversations, and we'll continue to advocate for climate actions providing some kind of a benefit for health as we move forward.
I think we got time for one more quick question, but you'll have to compress your answers. But can you talk about the costs and benefits of increasing urban density as a means to reducing transport emissions? Jonathan, is that anything that you've thought about, or some of your colleagues have been talking about?
Yeah, there's a fair number. As with increasing urban density, you have more more options for active transportation. So it's easier for people to walk, bike, and as we've shown, those have pretty serious health benefits.
Yeah, I would echo that. I know that there have maybe been some push back to increasing density for various reasons, but it does help address so many of the challenges with, walking, biking. The shorter we can make trips, the more accessible those are, the faster and more efficient our public transit services can be. Increasing affordable housing, especially in our community centers, is so critical for connecting people to jobs and services. Basically, the closer we can put things that we need to get to together, the shorter our trips are going to be, and the more alternative options we'll have for getting there. So, sounds like a good strategy to me.
Well, thank you, gentlemen. And with that, I will turn it back to Brianna, and I encourage people who are on the call to, you have our email addresses. I'm sure any of us would be happy to answer any further questions and discuss this more. But thanks again to my fellow speakers for joining me here. Appreciate it.
Well, thank you, Dan, Jared, and Jonathan, for that wonderful presentation. And yep, the presentations will be on our Facebook page by the end of the day today. But thank you all for joining and participating in the conversation, and we hope to see you next Friday at noon.